Okay, and is everybody able to see the slides? Excellent. So let's get started. So first off, I'll just start by updating you on what the case trend looks like in Ontario, updated with the numbers that are just released about 30 minutes ago. And fortunately, we continue to see that downward trend is continuing. So that's really good news. I've talked in the past about how this line seems to be less steep coming down versus when it went up. There's a little sense that maybe it's speeding up a little bit now. And actually, if you take a look at the reproductive number, I talked about in the past how the reproductive number was below 1, but not as low as it was during the second lockdown. It does seem to be actually dropping a bit more. So the Ontario cases do seem to be starting to speed up in their decline. And what I'd attribute that to is actually the vaccination strategy that the province has been following. With a lot more vaccines over the last few weeks have been directed towards the hotspots where most of infection is spreading, I think it's actually made a noticeable difference in the spread of infection. And therefore, we're actually seeing the reproductive number fall lower, and we're starting to see cases come down. As a reminder, this is what the province had been doing over the last few weeks, where they directed 25% of all vaccine to hotspots on top of the proportional distribution that the hotspots are already getting. And then for 2 weeks, it up to 50% before this past week returning to a per capita allocation. And so for those 3 weeks, there was a huge flood of vaccines going into the hotspots. And I think we're starting to see the benefits of that. And just to remind you of, what that looks like across multiple different age groups. So, these, highest incidence of COVID infections would be these deciles. So these would be the hotspots, and then if you're going across age groups, if you're looking at the vaccination rates, you can see in the hotspots here, the vaccination rate is now higher than it is for other parts of the province, where you're approaching 60% here, where it's close to only 50% outside of the hotspots. And that's a big difference from where we were, say, at the start of April. So if you're taking a look at, I think this is the start of April 1st, you can see the hotspots were 8 to 10% vaccination uptake at that time, whereas the rest of the province was more like 11, 12, 13%. When some additional focus started to go to hotspots with younger ages being eligible in hotspots than there were elsewhere, there's a small impact, but you can even see here, outside of hotspots, about 20% of people were vaccinated. In the hotspots, it's falling down to 15, 18%. And so there's been a real shift in those hotspots to now actually have the vaccination rates higher than the rest of the province. And that's really driving, I think, some of that increased the reduction of cases province-wide, which is really good news. And I think we've seen that, the Toronto, Peel region particularly, those case numbers have come down quite sharply. And that's where the vast majority of these hotspots are. So I think that's a good, news story around the vaccination strategy the province has followed. That's really actually helping us now get this pandemic under control in the province. If we look at this, that the Ontario Science Table put out across the 34 local public health agencies, you can see that the vast majority of us are seeing a reduction in cases over time. This is Niagara here. We've had a reduction over those 2 weeks. There's a few places where unfortunately it's gone up, but you can see most of these, it's basically almost flat. It's only 2 or 3 places where there's been a real increase. And I think, focusing on these hotspots of Peel, Toronto, Durham, York, you can see big decreases in all of those. And I think that's really a reflection, again, of that strategy around vaccination really working there. Switching then to the Niagara story, of course, we've seen a reduction in our cases. Our reproductive number, you see, doesn't show that same pattern of the province where it's dipped farther in the last little while. And I think that's because we, of course, only have one hotspot. Most of our population isn't in a hotspot. And so we didn't see that benefit of a lot of flood of vaccines coming into here the way Toronto, Peel, and other areas did. And our reproductive number remains higher than it was during the second lockdown. But of course, our cases do seem to be coming down. And if we take a look at the case trend, you can see it's actually come quite a ways down from where it was at the peak earlier. We're starting to get closer to where we were in mid-February. And I'm pretty optimistic that by the time you get to mid-June and the province is reopening, we'll hopefully be at quite a low number where we'll be able to keep the cases suppressed at that level. So taking a look at cases in terms of the provincial modeling of where things are going. So This was the modeling that the science table released end of last week. Red is sort of what they would say would be the trajectory if you look at the rest of the world, what happens when they're at this level. And then when you add in the effect of vaccination and what's going on in Niagara, there's two scenarios here. There's a scenario where you reopen June 2nd, and this is a scenario where you delay reopening by 2 weeks to mid-June, where you open up on June 16th. And you'll remember in past weeks, I've been very much arguing that we want to do a mid-June reopening, and you can actually see how the modeling plays out here. If we reopen June 2nd, cases rebound to being above 1,000 and only slowly decline over time. Whereas if we reopen mid-June, they actually stay low and keep going down pretty quickly. And so that's, I think, exactly what we're hoping to see. Looking at hospitalizations in the province, we can see hospitalizations are steadily coming down. We're not too far away from where we were between the first and second waves now. So we could perhaps be there in a couple of weeks. So that's good news. And then if we're looking at ICU admissions, they're starting to come down a little bit as well. And so that's also good news. That being said, of course, these hospitalization numbers are still really high. You can see where the peak of the first wave was. So we're almost at that level still. The ICU numbers are still higher than we were at the first or the second wave. And so there's still a lot of ways to go before we can completely relieve our hospital sector. And if we're looking at, transfers between hospitals, particularly, GTA hospitals handing off to other locations across the province, you can still see there's a lot of transfers from acute hospital care unit in one hospital to the acute care unit in another hospital. And I think that's really, a reflection that the GTA hospitals are still pretty overwhelmed. Niagara has been taking fewer patients from outside of Niagara, but we still have, over a dozen patients from outside of Niagara in our hospitals. And that's a reflection that I think the GTA hospitals aren't ready yet to really take the full burden. And there's more work to do to really relieve them of some of the pressure that they went under during the third wave. If we take a look here then of what hospitalizations look in Niagara, you can see the hospitalization numbers have been fortunately coming down for quite a while here. The ICU numbers are pretty flat. And if you look at who's in our ICU, over half of our patients in ICU, I believe, are still patients from outside of Niagara. And so we're partly seeing a reflection of us helping out the rest of the province in terms of ICU admissions still. Looking at what the modeling shows from the province, it does show that we could continue to see a pretty steady decline in people being hospitalized and being in the ICU. By mid-June, when we would perhaps reopen, we could be under 400 patients in the ICU. So I think that's pretty good news. Of course, the danger level the province used to have was 150. So we still have a ways to go back down there. But if we're under 400 from starting at close to 900, I think that's, made some pretty good progress. And hopefully with the cautious reopening the province does, we'll continue to see this able to come down a bit more. And so, quickly talking about the reopening plan the province did put out at the end of last week. There's going to be 3 steps of reopening. Mid-June will be the first step. We'll have to wait 21 days before the second step to make sure, hospitalizations, ICUs, admissions, cases are all coming down, and make sure we've met the vaccination metrics as well before we move on to the next step, which I think is sensible to make sure you're not seeing cases start to spike before you move on. And then again, waiting 21 days before moving on to the third step. 21 days, I think, would be the bare minimum you'd need to see to make sure that you can see if there's a change in trend of cases. So I think they built in the appropriate amount of time there. And the plan is good in terms of focusing on outdoor activities first, where we know the risk is lowest, before proceeding on to small indoor activities and then larger indoor activities. So overall, I think the sequencing of this plan makes a lot of sense. I just want to talk a bit about the vaccination targets that the province has put out here. And the first thing that I noticed about these vaccination targets, 60% of adults with 1 dose, 70% with 1 dose for the second step, is they're actually fairly low bars. We in Niagara have actually already crossed the 60% threshold. I think we're at 60.9% of adults actually have a first dose. And if we look at bookings for the next couple of weeks into clinics, that actually gets us up to 69 point something percent. So we're almost at that 70% with just the bookings in place. So I actually think we're going to be well past these vaccination metrics by the time we get to them. So it's a little bit odd that the province shows such low thresholds when it looks like actually the province is going to easily beat these thresholds. The other part that I think is a little unfortunate is that these metrics don't really align with what the Public Health Agency of Canada put out. So, the 60, 70, 70 to 80% here, if we look back to what the Public Health Agency of Canada showed, and I showed this previously, is that their modeling showed that if you had 55% of adults vaccinated, you would still see a surge of cases hospitalized. Instead, if you open at but 75% of adults vaccinated, you're not going to see that surge. And so they were really advocating that 75% of adults should be vaccinated and 20% have received their second dose. And so it's unusual that a province has gone with lower thresholds. Now, looking at what I'm seeing across the province, I expect that by mid-June, the province will actually be at about 75% of adults anyway. I'm not sure if we'll quite get to 20% of second doses, but I think we might actually be starting to get, in the ballpark of there as well. So it's unusual that we didn't just go with what the Public Health Agency of Canada put out so that we could be aligned across the country, given that we're probably going to meet these targets anyway. The other thing that I didn't really see in the Ontario plan versus what the Public Health Agency of Canada put out is the Public Health Agency of Canada put out some guidance of when we can start to back off on wearing masks and keeping physical distance. And so they talked about once we get to that 75% and have a first dose, 20% have a second dose, you can start to look towards, small outdoor activities. When you're indoors, you need to keep up with physical distancing, wearing a mask, but there would be some opportunity to let up with this when outdoors in small groups. And then by the time we get to the fall, we'd be able to start to reopen some indoor activities with some larger, numbers of people. And this sort of aligns with, what is in step 1 of the provincial framework. This is probably closer to step 3. And it's a little unusual that, we didn't align these vaccination targets to what the, federal government put out, particularly with step 3, if we're aligning with the federal government, we'd have 75% having their second dose, which will probably be a bit closer to September as opposed to, probably early August, which is where we're probably headed to provincially. So there's a little bit of inconsistency there, which I think is a little unfortunate. I talked about how, Ontario is probably pretty close to actually meeting that 60% with 1 dose. And so this is the Ontario Science Table putting out as of the end of last week. Ontario is already at 7.6% having had their first dose. That's as of adults. And so we're pretty quickly and possibly already have passed that 60% threshold. So again, it seems an unusually low metric. Focusing a little bit more on vaccinations here in Niagara, this is what our uptake looks across age groups. This is, of course, across all residents. If we're looking at just adults, as I mentioned, we're actually already over 60%, pretty close to 61% of just adults. But we're, of course, now vaccinating some people who aren't adults. And so we definitely want to count them. And I think if we're thinking about protecting our population as a whole, we don't want to be ignoring those 0 to 11 years of age who are not yet eligible for a vaccine. But we continue to make good progress. We have very high coverage amongst our elderly groups who are, of course, at greatest risk. And we're continuing to see increases across some of these younger age groups. And I particularly note that, if we're looking at the 18 to 29-year age group, we've already got over a quarter of them vaccinated. And if we look at who's booked in for vaccination, that number goes well above 50%. Likewise, for the 30 to 39 age group, we're up to 60% once we add in the people who are booked in for vaccination. 12 to 17-year-olds, I think we're up to about 25% of them are booked in for vaccination. So we've got lots of people in the queue to get vaccinated, particularly in these younger groups where we need to continue increasing our vaccination uptake. Just want to highlight that, if we're going back to the, Ontario, plan here, outdoor activities, did open up somewhat this weekend, and they are going to open up more in step 1. I think for people who partake in those outdoor activities that are now open as of this weekend, thinking particularly about things like golf, tennis, basketball, those sorts of activities, some of the Ontario Science Table advice here, I think, is really key, that we're allowing these outdoor activities, but we're not yet allowing people to stop wearing masks and keeping distance. So when you're having that outdoor gathering of 5 people that's permitted now, you should still be keeping distance, wearing masks, or at least one of the two. And what they propose is actually this, that if you take outdoors, keeping distance, wearing masks, you should always have two of the three in place. So if you're outdoors and you're keeping distance, you don't need to wear a mask. If you're outdoors, but you're not able to keep a distance, then you should probably wear a mask. And of course, if you're not outdoors, you need to be both keeping distance and wearing a mask. And I think that's a really key message, that what occurred this past long weekend wasn't relaxing the rules and returning to normal with outdoor activities. It was relaxing the rules to permit some of these outdoor activities, but that we still need to be mindful of either keeping distance or wearing masks when participating in these activities, because there still is some risk, and we're not at the stage where we can start to reopen. And if we're following the Public Health Agency of Canada's advice, we'd want to be close to 75% of people having had a first dose of vaccine before we would do that. Obviously, they also emphasize that a lot of these other public health measures remain ones that we need to be practicing. So if you're going to go out, play golf, play tennis, you don't want to be traveling outside of your region. You don't want to be staying over with others, or carpooling where you're going to be in close contact and could spread infections. You don't want to, combine playing golf with having drinks or eating with your friends in a picnic and possibly spreading infection like that. So making sure that the activities that are permitted this weekend don't actually lead to a complete lifting of all of our precautions. They go on here to kind of elaborate some of the, activities and how you'd want to do that. So, talking about basketball and tennis, playing with singles of your tennis, wearing masks and participating in these activities because you might be close to people from time to time makes them safer. So, definitely want to keep up these measures going forward. Lastly, I just want to stop and take a look at the national vaccination trends here. I think there's some good news here, and perhaps many people have already noticed this. So this is the trend of the United States delivering, a number of people who've been vaccinated with at least one dose of vaccine. And I think it got a lot of play that Canada has now overtaken the US in terms of people having had one dose of vaccine. And that's good news. I don't know how meaningful it necessarily is. To me, what's actually much more interesting is just the slope of the line of people taking up vaccine in the US, where things have really slowed there from where they were earlier, where there's a lot of uptake and it slowed down. Whereas in Canada, we don't seem to have slowed down in terms of our uptake of vaccine. And so what I think is really positive about this is that hopefully that, we get a larger proportion of our population vaccinated still. And then once we get to second dose, we're able to get the same proportion of people vaccinated with a second dose. And if we're able to do that, I think that sets us up really well, that we're not at a stage similar to the US where around 50% we're plateauing in how many vaccinations we deliver. And just to compare us to a couple other countries who've done the best in terms of vaccine rollout, taking a look at the United Kingdom here, you can see the United Kingdom is kind of flattened out as well. They're closer to 60% where they've ended up with vaccinations, but it looks like there's a good chance that we in Canada could actually overtake them the next little while. So if we're able to do that, that's really good news that on an international basis, we're convincing more of our population to get vaccinated. And then I think, one of the world leaders in vaccination has been Israel, that we've talked a lot about. And you can see that they really plateaued a little bit above 60%. And so it'll be really interesting to see if we're actually able to catch up and maybe overtake Israel. I think 60% is a fairly low bar in terms of vaccination uptake. We probably need to be close to 90% to get something approaching herd immunity for vaccinations. And so I think it's good news that we are still on an incline, and hopefully we're able to do better than some of our international friends in terms of getting up to something closer to that. Because if we do that, I think that really makes things a lot safer in Canada for us to really reopen, even perhaps a bit more aggressively this fall once we start to get those second doses out to many more people. So with that, I'll stop and turn it over to questions.
Thanks, Dr. Hirji. My internet is a little sketchy today. So if I cut out, when I just got the notice again, your internet connection is unstable. So if I cut out, Courtney, please feel free to jump in. So first, I will turn it over to Paul to ask a question. You should be able to unmute now, Paul.
Oh, can you hear me?
Yep.
Oh, great. Well, thanks, Meredith. Dr. Hirji, with the first step of allowing some relaxation of the outdoor activities, gathering with people other than our household, You touched on that, but I guess is it important to stress to people that the danger is still there, that could it inadvertently allow people or cause people to relax, their guard too much?
Yeah, I think one worry I had about allowing these outdoor activities is that on their own, these outdoor activities, there's an increased risk of infection spreading from them, but it's not going to lead to a flattening of our case numbers or resurgence of spike because these are relatively low activities. The thing that's going to really, I think, harm us is first off, just the message that we're in a stay-at-home order, except we're now able to have small gatherings outdoors and we can participate in some of these activities. And it starts to weaken the simplicity of that message. And perhaps it confuses people to think that they're able to partake in a lot more activities than they would otherwise do. And I think that's where the biggest risk of infection spreading comes, that it sends a signal that we can relax much more than I think strictly the rules were trying to say that we could. And then the other part, as I emphasize, is that despite, these outdoor activities being allowed, despite these small gatherings being allowed outdoors, we're still at a time when we haven't seen cases come down all the way. There's still a fair bit of risk out there. And so we want to make sure we do these outdoor activities in a safe way, which is either wearing a mask or keeping distance when we're doing these outdoor activities.
And a follow-up, Paul?
Yes, with the vaccinations now ramping up among the younger groups, the younger adult groups, they're the groups that throughout the whole pandemic have been the main spreaders of infection. Do you think as those groups, as the rates ramp up among them, will we see the overall caseloads drop more sharply as those vaccination rates go up among those age groups?
I'm not sure we're going to notice it being much more sharply just because our case numbers have come down quite a bit already. We're sitting around a little over 30 cases a day at this point. So if things go down more sharply, instead of going down by 4 or 5 cases, goes down by 5 or 6, I'm not sure we would necessarily really notice. But I think your point about as we get those younger age groups vaccinated, it's going to have a real impact is a good one. And if we look back at this Ontario breakdown of vaccinations, you can really see here in these hotspots where they were allowed to start vaccinating those younger age groups earlier and were able to flood vaccines to vaccinating them. You have 40, 50, 60% of these people vaccinated. Whereas if you move over to the rest of the province, in the areas where you don't have as high transmission, you're back in the 20, 30%. So I think part of why you saw that, drop in the reproductive number province-wide is actually because this group that is spreading infection the most in the hotspots is the group where we've been able to get much more vaccine uptake to.
Okay, thanks, Paul. Up next, we have Gord Howard.
Hey, Dr. Hirji. Hi, everybody. Just wondered, we're seeing some growth now in the second dose vaccinations in Niagara, but it's just a fraction of a percent. Based on the bookings, do you expect that to start speeding up soon, or is there anything you can do to speed that part of it up?
Yeah, so second doses, as you remember, is really based on 16 weeks after you got your first dose. And so it's probably not going to be until we get to July that we really start to hit a lot of people who are at 16 weeks out and we start to see that ramp up. It's picking up a little bit across over the next 4 to 5 weeks, just because, late February, March is when we start to see some vaccine shipments, and that's the group that's becoming increasingly eligible for second doses. I think we'll probably see in other parts of the province where they were able to start vaccinating earlier than us, when they got vaccine earlier than us, that they'll probably be a bit ahead of us in getting second doses just because they were ahead of getting vaccine to do first doses. And so those people become eligible earlier on. The groups that we're particularly seeing getting second doses right now are some groups where the province has made an exception to actually bring up their second dose earlier. So we're talking the highest risk healthcare workers, persons working in long-term care homes, retirement homes, working in a COVID ward in hospitals, paramedics, ICU workers. Those people are getting their second dose right now, just to give them that greater margin of safety, given that they're at the greatest risk because they actually see COVID patients up front. And then the other group who's been prioritized a bit earlier have been Indigenous people. And so we're actually doing some clinics actually even today for our Indigenous population to get them their second doses. And so that's why you're seeing that little bit of tick up right now. I don't think it's going to really speed up until we probably get closer to July, though.
And a follow-up, Gord?
I'm not sure. I thought I heard the province was offering people to sort of an early second dose of AstraZeneca to use up the supply that's there. Would you recommend people take that early dose, or are they better off waiting a little longer to get stronger immunity?
Yeah, what the province has done is that because there's AstraZeneca expiring actually at the end of this month, so in the next 6 days, the first groups who got vaccinated back in early March, which wasn't in Niagara, the places they first rolled out pilots in pharmacies and primary care vaccinating, they've offered them to get their second dose now, which is around 11 to 12 weeks. So that's pretty long interval already, and that makes sure that none of this vaccine goes to waste. What they've recommended for everybody else who got AstraZeneca is that at 12 weeks, you'd be eligible for your second dose of AstraZeneca. And I think that's a pretty good timeline. I've talked in the past about how the AstraZeneca clinical trials actually looked at, doing the doses at 4 weeks apart, 8 weeks apart, and 12 weeks apart, and found that immunity was better at 8 weeks, and then even better when you got it at 12 weeks. And so I think the province is aligning to make sure that there's that longer interval, but also trying to see if they can use up the AstraZeneca vaccine that we have on hand in a sensible way. So I think it strikes a good compromise. And when people get to their 12 weeks, I'd encourage them to take that opportunity if they feel comfortable taking AstraZeneca for their second dose. I just want to highlight that the second dose of AstraZeneca has been found to be much safer in terms of the clotting issue than the first dose. The clotting issue is mostly seen with that first dose. The risk is probably about 20 times lower with the second dose of vaccine. And so I think people should feel comfortable taking that second dose, but if they're not, there'll be the opportunity for them to get a second dose with a different vaccine product at 16 weeks instead.
Thanks, Gord. Up next is Penny Coles. Over to you, Penny.
Hi, Dr. Hirji. My question is kind of a follow-up to that, and I was wondering whether you have any knowledge or information about when our pharmacies will start to get AstraZeneca for that second dose. They lagged behind the first time, and now they're lagging behind again. Any word on that?
Yeah, so AstraZeneca will only be used for second doses, and the provincial policy is not to really give the second doses until about 12 weeks after the first dose. So we're really going to be looking at 12 weeks from when first doses started. So I believe it was start of April or so that we started to get AstraZeneca. I'd have to go back and look up that. So I would expect probably end of June would be when we start to see AstraZeneca doses back in pharmacies and primary care to do those second doses here. But it's whenever it's going to be about 12 weeks after that first dose.
And a follow-up, Penny?
So that means that there is no sort of early window to help use up AstraZeneca. I guess that will get used up in Toronto and other parts of the GTA.
Yeah, that's correct. So the places where people have got their first doses earliest, that's where we're going to use up the expiring vaccine for AstraZeneca.
Okay, thanks, Penny. Up next is Lisa Hepner.
Okay, hi, thanks very much. Dr. Hirji, I thought your last point in your remarks was really interesting. Why do you think Canadians seem to be less reticent to take the vaccine? Why is there more hesitancy elsewhere?
It's a really good question. I don't think I have a great answer. I can compare probably best with the United States. And I think there's a couple of things that immediately pop in mind with the United States. First off is that it almost seems to become a bit of the Republican leading political ideology for people to be opposed to vaccination. Donald Trump seems to have, kind of downplayed the importance of getting vaccination to his followers. I know there's some prominent politicians such as Rand Paul, who's been discouraging vaccination amongst, the U.S. population, even though he's a physician, and I think he should know better. And so, unfortunately, I think that is probably dampening the, willingness of a lot of Republican-leaning voters to get vaccinated. Unfortunately, we don't have that in Canada. All of our major parties support vaccination. It's only really fringe political movements who are downplaying the importance of vaccination. So I think that's one big difference. Another big difference I'd say between us and the US is that I think in the US, they've always had a very individualistic culture. It's always about what's best for you. Whereas in Canada, I think we've probably had a better balance where we also take into account is what is good for our society at large and us doing our civic responsibility for the benefit of society. And we've definitely heard that from some of the people who've chosen to get vaccinated here in Canada, that they're doing it because they see it their civic responsibility to protect all of society and help all of society recover from this pandemic. And so I think given that we have that, there's probably a greater willingness among some Canadians to take up the vaccine for that reason. When it comes to the UK and Israel, I don't really have much insight into what the thinking there is, so I can't really comment of why we seem to perhaps be on trajectory to do better than them as well.
And a follow-up, Lisa?
Yeah, so we've also heard that it's a global pandemic and it's not over until it's over everywhere. So what does this say about the future of the pandemic and an end to it?
Yeah, so, what I think this does is it protects us in Canada from the pandemic, but it does not end the pandemic. Because as you say, the pandemic, as long as it's spreading elsewhere in the world, there's going to be the potential for people to travel and bring infection here. There's going to also be more variants emerging in countries where infection is spreading widely. When infection is spreading frequently, there's more mutations that emerge, more chance a variant could come, and then those variants will be reintroduced here in Canada. I also think a big risk for us is that we're not going to have 100% of our population vaccinated. There's going to be some percentage of people who are vaccinated, despite that, are going to get sick. And so when winter comes, I do worry that we'll see a small surge of COVID cases again. I don't think it'll be like our waves of infection that we've had over this past winter, where it overwhelms our hospitals in the same way, but I think it will increase strain on our hospitals. And our hospitals every winter already are strained by influenza cases. And so I think this is going to add on to it. And so I do think it's going to remain a challenging time for us over the winter months. I don't see us, closing down society in the same way to prevent COVID cases, but I do think there's going to be a lot of COVID precautions that are probably going to linger with us for a couple more years until we're actually really able to bring cases under control across the entire globe, as well as get our vaccination rates as high as possible. And part of getting our vaccination rates as high as possible is going to be getting a vaccine that we can use in those 0 to 11 years of age. And also, if we need boosters, making sure we get a good uptake for boosters and all of that. So there's, I think, a lot of variables at play for us to really get past the end of this pandemic. The good news is I think we're pretty close to getting past the worst of the pandemic, but it's going to be a while longer where we need to continue to work here, as well as really support a lot of countries around the world that aren't as wealthy and as fortunate as us to have vaccines, to really help them get vaccinated as well, so that we can protect the entire global community.
Thanks, Lisa. Finally, we have Richard Harley. Over to you, Richard.
I joined late, so I don't really have any questions today. Thank you, though.
Okay, thanks, Richard. If anyone else would like to ask a final question, can you please let me know in the chat and I will unmute you. Thank you.